Hello, welcome to a follow-up to mycotoxins and chronic illness.
We're so happy that you could join us.
It has really been an exciting time getting out all that information. But today, I thought we'd have a little conversation about how to get started in taking care of your body and helping it be efficient at removing the toxins that we're exposed to.
So when Dr. Jill Carnahan interviewed me probably about 3 months ago, we talked a lot about detoxification, and I coined the term Pretox, and that is how we prepare for detoxification therapy. So Dr. Gordon, would you like to share with them a little bit about detoxification and why we do that? Why do we detox?
Our bodies are designed to be able to deal with our environment. And the issue that we have today, though, is our environment has changed dramatically in the last 40 years. The level of chemicals we're exposed to, the amount of just drugs that we've been exposed to. So it's really important that we attend to this and attend to it efficiently. And when we start, we really need to pay attention to the whole system. And so what are some of the things, what are the first issues that you like to address with your patients?
Yes, so let's go back to the term pre-tox. I think that's very, very important. There are many detoxification programs going on right now, right? It's a hot topic. Your yoga instructor or Pilates instructor, or maybe even your local grocery co-op might be offering you a detox program. However, if you have chronic illness, it's important that you do a pre-tox as well. So that might mean that we have to take a look at your gut. There might be constipation. That's an issue. If somebody's constipated, then that they're not able to send the toxins out of their system. They'll just recirculate. Taking a look at the gut is very important. Beyond constipation, you might have SIBO, there might be parasites, there might be viruses in the gut. And if that's not dealt with, then detoxification is a very difficult process. We also want to look at the liver and the kidneys. So if there's inflammation in the liver, or if somebody drinks a lot of alcohol, their liver might not be prepared for detoxification therapy. So there's a lot of work that needs to be done typically in our patient load before we even begin the process of detoxification. That's what I mean by pre-tox.
Yeah, and that's why I like that term so much, because what people forget is that when you do have issues with your gut, which unfortunately is very, very common, whether it be anything, constipation, diarrhea, anything inflammatory, anything that doesn't feel right, you really shouldn't feel your gut. When you're feeling your gut, it's working harder than it should be. And that usually is going to stress your liver. That's something, and that's where I think the Dr. Parpia's concept of the pretox is so crucial, because we don't realize how much work our liver has to do. And so I think it's really important that we address it.
Absolutely. And of course, we understand why detoxification is such a popular thing these days. Our world is toxic. And yes, our bodies are designed to detoxify. We have our organs of elimination, the liver, the kidneys, the skin, the gut. However, we didn't evolve to deal with this high of a toxic load that's thrown upon us, that we have thrown upon ourselves by what we've created on the planet here today.
Yeah. So what's your favorite ways to start?
So I like to test people. I like to measure their environmental toxicant load. I will look at chemicals. I'll look at heavy metals. But I'm also going to look at their genes of detoxification. And I'm also looking at their genome sequencing, actually, because I want to see what other areas of their system may have potential for compromise. And I will weave that in with what I find on the labs for detoxification. Um,
Yeah. I just want to say, I think if you look back at the Mycotoxin summit, you'll see we had a nice episode with Dr. Sharon Hausman-Cohen that I think gave some really good examples of how important the genomic variants can be for the individual, and especially those people who are having problems with their health. Yeah.
Absolutely, that was a great talk, and really, it's looking at your biochemistry, what's happening inside of you, in your cells, in your white blood cells, in your genes, in your gut, in your neurotransmitters, it's your brain chemistry, your hormonal system. So these environmental toxicants, they cross the boundaries of all of these systems. So it's important to look at all of your different systems, as well as the toxins that are present, as well as the genes. So that's why detoxification is not so simple for our patients.
Yeah, and I think what's really exciting is that we hope next year to bring you a series where we go over the various testing modalities that are offered, because there's a lot of them, and they're useful, but often depending on your situation. I mean, it can be a little overwhelming when you look at the menu of tests that are out there. And so that's something that we hope to deliver next year, and also things that you can do at home, because, you need your physicians to guide you, but detox and pretox, preparing your system, is something that's an ongoing process. It's not something that you do, once in a while. It's something that you have to make part of your lifestyle.
Exactly. I love that. It's definitely not just a thing that happens. It's not just a program you go through, but it is lifestyle now, because unfortunately, it is a toxic world. And
I just want to be, can you mention some of the, I mean, because one of the things that I've always been impressed with how careful you are in selection of just everyday life products, of things that we do, and it's just things that I didn't think about. So just go, through a little bit of the of personal care items, that just what people should think about.
absolutely, organic, natural toothpaste, of course, that's going in your mouth. Swallow it. Shampoos, conditioners, even makeup, ladies, and of course, food, beyond products, organic foods, grass-fed meats, as much as you can, is very, very important.
Yeah, and even, I mean, you've I've been educated over and over again, but how important everything is, even as far as clothing, and making sure that that clothes are washed before we wear them, when we buy them, because there's many chemicals that are used in the preparation. Just the cottons that you buy. It's, unless you're buying all organic cotton clothing, you have to be careful, watching out for the dry cleaning.
You want to go to a green dry cleaner for sure.
Yeah.
Yeah.
And even there, best to make sure you air those clothes out. Try not to bring them in your house, and especially not bring them in and stick them in your closet, and close it up. And the EMF world, I think, is something that we will explore more. Again, is that it's all the load. We live in a toxic world that we have come to love. I mean, we do enjoy all the our telephones. Where would we be without our phones and computers? But we have to learn how to use them carefully and judiciously. And it's the same thing with the exposure to foods and food products. We really want them to be organic when we all possible.
That's to care for the earth and to care for our bodies. One thing I want to mention is that I'm seeing a lot of arsenic, mercury, aluminum in my patients' blood and urine unprovoked. just through a basic lab core test. And, that's in our food.
Yeah.
That's in our water. And most of my patients are drinking filtered water. A lot of them are even showering with filtered water. So it's in our food, it's ubiquitous. So it's important to lighten the load on the planet and on our bodies.
So thank you very much. It's been fun to talk to you again. And I said, looking forward to bringing you more information over the next year.
Thank you very much. Look
Bye.
forward to more.